My name is Cynthia Nichols. I've been coming to vision specialist about 5 years now. Actually, my next door neighbor where I live is my nurse practitioner. She came across Dr. Debbie, sent me the website to go to, and she texted me and she said, I need you to go to this website. I think this is you. And I went to the website and started crying. I started crying because after 11 and a half years, I had no hope. I had no hope of ever getting rid of this headache because it would never break. I don't know why it started and set in. I don't know why. I had always had headaches. I'd always had migraines, but this one set in and would not let go. So I don't know why, but I remember the day vividly. I had everything. I had everything going on. I felt like all I did was when I went to the doctors was just whine because my head hurt. I had dizziness. Driving spatially was very difficult. Walking down hallways was difficult. I never felt like I had my feet solid to the ground. I was motion sick all the time. Always nauseated, always motion sick. Lights and sounds were horrible. It was just debilitating. But you can't just stop. You just can't stop living. You have to keep on going. But it was miserable. Miserable every moment of every day. Even to the very last neurologist that I saw, which was probably my 8th or 9th or 10th neurologist, he finally said to me, I've had you on 3 single sheets of papers, drugs. We've done physical therapy. We've done everything I know to do. He said, all I can do for you is pray now. He said, hopefully, maybe as you grow older, they'll get better. But he said, I can't do anything else for you. And so I left his office. So when my next door neighbor, my nurse practitioner, found Dr. Debbie, it was like, I looked at the website and when I was crying, it's like, this is exactly what I have. Exactly. And no one else in the world knew about it. I filled out the questionnaire and she called me that same night, which just blew me out of the water, that she had taken the time to call a total stranger. And she said, I want to talk to you about your test results. And I said, well, I'm assuming I failed. I don't know what failing is. I'm assuming I failed. And she kind of laughed a little bit and she's like, well, you didn't do real well. I'm like, thank God I didn't do well because I really want to come in and see you. When the very first time I came to see Dr. Debbie, it was very nerve-wracking for me because I was afraid that it wasn't going to work. But I also knew I had to do everything I could to try to find some help. And we came in and they took us around and met with all the different technicians and did all the different tests to get me ready to see Dr. Debbie. And then I met with her, Eric and my husband and I met with her, and she was so kind, so sweet, just an understanding and encouraging. So we started doing the eye exam and she did the different lenses and all her testing, and then she said, I want you to put these lenses on and go sit in the waiting room for about 20 or 30 minutes. And it was amazing because I sat in the waiting room and I'm talking 11 and a half years, and within 20 minutes I could feel my head relaxing. And I told my husband, I said, I feel better. In 20 minutes. It was absolutely miraculous. And so we went back and we met with her again, and then she had me walk up and down the hallway. And it was so cute because I felt as I was walking down the hallway, she would watch my gait to see if I was, listening either way. And I came back and she had told my husband, and I was walking away, she says, look at her, she's swinging her arms. Because I was comfortable walking. It's not just the glasses. She works with you with sound, too. I have found that sound is a huge part of my healing. Huge part of my healing. I found out about the sound and the healing 2 visits ago. And she had these Bose sound reducing headphones. And so when I went out with the lenses when I first got here, she said, put these headphones in. Actually, it was Dr. Mary Jo. Dr. Mary Jo I saw that time. And she said, try these headphones. So I sat in the waiting room and she put them on me, turned them on, and I could immediately feel myself relaxing even more. I didn't realize how much sound played into my migraines. I've since been to an audiologist who has checked my hearing and told me I have perfect hearing. I didn't think I was hearing well. The thing is, I'm hearing too well. My head is letting in every sound there is, which is aggravating, my head. So I have these Bose little earbuds I put in. It's got a little piece that goes to it. You can turn the sound off, and it just kind of makes the world quieter. And it's amazing the difference in just tuning the sound of all the chaos out and having it quieter. I can still hear. I can hear to talk to someone, but yet it's not constant. I came to vision specialists at an 8 in pain, 8 out of 10 on the pain scale. The first day I left, it was down to like a 4. And so I wore the glasses. By the time I got home, within a week or two, I was down to a 0 headache, which was miraculous. It was miraculous. I never dreamt I could ever be headache free. And now I take it for granted that I'm headache free. I used to come every 9 months or so, but I have found with me, I'd prefer to come every 6, because every 6 months I come in and I know everything is healthy. I know everything's working well. I can get my glasses tweaked at that point, and it keeps me headache free. So I don't wait the 9 months anymore to wait until it could get bad. I come in more preventative. What I can do now that I couldn't do when I was sick is I can actually make plans, and I can keep them. I don't have to worry about if we're going to go out of town or if I'm going to go, to dinner theater with my girlfriends or whatever. I can make plans and know that I'm not going to have to be sick. I can go and do it and enjoy it, which is wonderful. I mean, it has given me back my life. I can travel. Yeah, I can do anything I want to now. I know I'm not going to be laying in bed sick or hurting. My message to anyone who is going through the pain of symptoms of migraines or dizziness or nausea or neck and back pain, and it's just so interwoven, all the different things, is you have to do everything you can to get better. And no matter where you have to travel from, no matter what you have to do, you need to try with the glasses, with Dr. Debbie. It's worth whatever you have to do to get the help. If I could talk with all the doctors that I had seen previously, I would ask them to be educated in this. I would ask them, a lot of the doctors, I don't know that they really understand how dramatically your eyes are and how they sit in your head. I always went to the eye doctor. I went every 6 months to the eye doctor, but not realizing that my eyes are not sitting level in my head. They're not sitting level. They're not seeing together. I think my eyes, they're trying really hard to see one image, but they weren't doing it. And they couldn't tell that from your typical eye exam. I would really ask the neurologists, the general practitioners, the eye doctors to be educated and take this as a very serious disease that people need help from this. And if they would just become knowledgeable, they'd be able to look at the symptoms and say, the drugs didn't work, the physical therapy didn't work, I had sinus surgery, I had, acupuncture, I had everything you could do. But when nothing helps, look and see where it could be coming from. And with me, it was coming from my eyes, which is, people will say, well, you just got a new pair of glasses. No, it's not just a new pair of glasses. There is so much to it, so much science behind it, so much research that Dr. Debbie's done. So I would just really ask them, educate yourself so you can help your patients totally. I can't say how much it has meant to me. I mean, I come here and everybody's so sweet and they're so nice and they take such an interest in you. I would do anything for Dr. Debbie. She has been miraculous in my life. She's been the greatest miracle I've come across, because she, through her knowledge and her skill, gave me back my life. And I would, Dr. Mary Jo, I've met with her. She's just as wonderful. You know, everybody here.
Yeah.
Everybody at this practice, from Lisa Kay up front to every one of the technicians to the scribes, it's the best run practice I've ever seen. And it's miraculous. For somebody who had no hope, coming here has been just miraculous for me. So I just want to thank them.